one of the things I see in your practice with our patients is your regular use of non-pharmaceutical supplements. And you indeed find them, or not you, but you find that they are helpful for your patients. Can you talk with us some about that?
Certainly. I think the bipolar patient wants to think about these supplements as medications, because they really are. And typically what we do is we put people on omega-3 fatty acids, folic acid, and N-acetylcysteine. And omega-3 fatty acids are fish oils. Well, why would we be taking fish oils? Well, because fish oils contain these crucial omega-3 fatty acids. And they work primarily as anti-inflammatory agents in the brain. Well, why do we need anti-inflammatory agents in the brain? The brain's not infected with bipolar illness. Well, the episodes, when you get severely depressed, when you get manic, those episodes cause stress on the brain, and they actually cause something called oxidative stress, and you get an inflammatory reaction. And so the omega-3 fatty acids work against the inflammatory factors that can occur in the brain that cause damage. And so you're taking these omega-3 fatty acids as a kind of preventive, and you want to think of it again as sort of a lubricant.
And the N-acetylcysteine?
And the
how is that different from the...
N-acetylcysteine is an amino acid, and N-acetylcysteine we put people on because that seems to help quiet, in particular, a part of the brain that generates anxiety, generates distress, an area of the brain that releases a neurotransmitter called glutamate a little bit too often, and it helps quiet that excessive glutamate release in this particular area of the brain that can generate distress and probably contributes to both mania and even depression. And the interesting thing about it is that you take the medication and it takes several months, but there's really clear evidence now that if you go on the N-acetylcysteine and can stay on it for a couple of months, you will probably not only feel better, but it seems to be one of the other things that helps prevent recurrent episodes. So that's the N-acetylcysteine, the omega-3s, and then folic acid. Folic acid we get in our vitamins, we get in fresh vegetables, and our body converts this folic acid into something called L-methylfolate, and that goes to the brain and is involved in the production of the synthesis of serotonin, dopamine, norepinephrine, the neurotransmitters that are involved in mood. And so it's a way of ensuring that you're getting adequate production of these crucial neurotransmitters. So nowadays with my patients, and I think most of my colleagues do the same thing, we want them on omega-3 fatty acids, N-acetylcysteine, and folic acid.
Now, for an individual who's going to purchase these supplements on a monthly basis, if I hear what you're saying, it really is something that you need to take continuously for a while.
Yeah, you want to think of it as a mood stabilizer.
Right. Okay.
Or
so
you want to think of them as I'm trying to think of something that we think of as a preventative. Just like
protection against.
Yeah, it's a protection. It's
right.
a protection against. But I think they also contribute to well-being.
And for the individual who takes these on a regular basis, what can they expect to spend approximately on a monthly basis for the supplements?
I'd have to look that up. I don't know off the top of my head because the prices are coming down. It's competitive, and I encourage people to buy them off the web. There are a lot of Amazon sells a lot of these, and health food stores, drug stores, grocery stores, because omega-3 fatty acids are now part of everybody's regimen. Because again, they seem to be involved in reducing heart disease and other illnesses. So if you're a bipolar patient, don't think it's something particular to you that you're taking omega-3 fatty acids. I'm taking them, and everybody, I think our age probably should, because of these anti-inflammatory effects then they help counter oxidative stress.